Okay, so let's look at the KV first. When we don't have this care KV means the system can adjust the KV based on the size of the patient. Um, we say don't do it. We want to set it up. Okay, if you look at this, for this particular scanner, we have a wide range of choice for the KV selections. We can choose as low as 70 and as high as 140. So normally we use 120, and this is what we are going to use for our scans. However, we can see if you, as we mentioned in the class, if you use a lower KV, you will have a higher contrast. If you use a higher KV, you will have a higher penetrations. So it's always a trade-off, and it's a call of the technologist, radiologist, and medical physicist to select the correct protocol. And the first parameter we consider is the KV. And on the left, you can see there is the effective MAS. And you can see we can just change it whatever number we want. Here, if you use, as you can see, if I change the effective MAS, you can see this number also change. This is the CTDI wall. This is the dose information that we use to quantify how much output of the scanner in terms of the techniques it's used. Okay, so as we adjust the effective MAS, you can see this CTDI wall also changed. We don't have time in our class to details talk about how this CTDI wall is related with patient dose, but basically you can see as higher, the higher technique we use, for example, is effective 200, 120 we have 12.8. If I change to 140, it will be 19.29. So the higher technique used, the higher CTDI wall and the higher the patient dose. Okay. And then related with that, you can see, remember this is effective MAS, okay? It's not real MAS, because one of the other factors it's used to determine effective MAS is the pitch, right? So yes, we can change the pitch. And as you can see, while I'm changing the pitch, this CTDI wall doesn't change much. Why? Because effective MAS doesn't change. If you have a MAS and then you change the pitch, then your effective MAS will change and your CTDI wall will change. But if you just change the pitch, the scanner will automatically adjust the real MAS to make the effective MAS as constant, so the output is constant. So this is a Siemens way of prescribing the parameters, and it's actually quite convenient. So what we want is 120 kVp, 200 MAS, effective MAS, and pitch equals to, because I always want to have a constant protocol, so pitch I want to set to be 0.6 so that I can compare different scanners. And then in this case, actually you can try to calculate what's the actual MAS. And this is another parameter, is the rotation time. Here by default is 0.5, and I want to keep it here. You can actually change it to 1 or whatever, okay? So, and then the other parameter you can adjust here is the detector combinations. So you can see that for this detector, settings, I can choose either 128 times 0.6 or 32 channel times 1.2. Okay, and for each of them, I can choose different reconstruction slice thickness. Okay, and you can see, well, this is a little bit confusing because I didn't introduce this concept. Although 32 times 1.2 is smaller than 128 times 0.6, it's actually a factor of 2. However, if you change that, the volume changed a little bit, but not much. And the reason is that this 128 by 0.6 is not kind of a real number. Siemens is using a so-called flying spot technique so that it can acquire double the channels, data channels that it used in real. So really, the detector width is 64 by 0.6. So, and that is the same as this one. So, and the reason we chose this is because it allows us to get more data, and that's our default use. Okay.